The Lao People's Revolutionary Party has told the government to investigate and determine the root cause of the mass outbreak of COVID-19 in Vientiane. The city has seen a sharp surge in COVID infections after numerous cases occurred in several factories, causing the virus to spread further among the general public. City authorities have imposed a full lockdown from September 19th 30th, but are struggling to impose controls. The lockdown was announced a few days after at least 430 people tested positive for COVID at LPRP, a garment factory in Nong Tha Nua Village, Chanthaburi District. In a notice issued on September 22nd, the party's administrative office instructed the government to work with the relevant sectors to investigate and determine the root cause of the outbreak and the responsibilities of the business operators involved. It also ordered the closure of all factories except for those producing medicines and medical equipment.
แล้วก็อยากให้ทางผู้เสพข่าวเนาะหรือประชาชนลาวทั้งหมดนั่นแหละทุกคนที่ว่าเสพข่าวฟังข่าวหั่นอยากให้ฟังจากแรงที่ถือทางการเป็นการดีที่สุดเนาะบ่ควร
President of the Association of Lao Garment Industry or LGI, Mr. Saibandit Rasapun discussed a claim circulated on social media with alleged that the virus outbreak at the LP Lao factory originated from a Lao mechanic who contracted the virus from two Thai mechanics brought in by another factory who did not undergo quarantine.
ของสร้างที่ว่าเฮ็ดอยู่โรงงานอิติเมกเนาะนี่แม่นคนไทย
Mr. Saibandit claimed that one of the Thai men had been living in Laos for 8 years and the other for 2 years, so they had not recently arrived in Laos. Dismissed the earlier post on social media as groundless. Hundreds of COVID cases were also reported at the Trio Garment Factory and dozens more at the Venture Garment Factory. To protect the general public against the virus, the party's administrative office has instructed the government to accelerate the vaccination program. Authorities were told to prepare more quarantine and treatment centers to handle the growing number of cases. The parties told authorities in charge to set aside an adequate budget for the procurement of medical supplies, vaccines, medicines, COVID test kits, and other essentials. The government was told to take steps to regulate the price of goods in local markets to prevent unreasonable price hikes. They were also asked to keep currency exchange rates and inflation under control.